Welcome to video 14 for Chapter 6 Bone and Anatomy and Physiology. So in this video we're going to look at trauma. And trauma to bone is a physical injury, and for most parts that is going to be a fracture. So the bone breaks. And we're going to look at the different types of fractures that are involved, and I will have some supplementary materials for you to look at. So with this, one way that we can compare fractures is open versus closed. And open is sometimes called a compound fracture, and closed is often referred to as a simple fracture. So with these, it all depends on whether the bone is breaking the skin. So in a compound fracture, the bone breaks the skin surface. So the bone is actually protruding from the skin. This is a much more dangerous situation because infection in the inside of the bone is always a concern. Simple, the bone does not break the skin surface. The other type of way that we can compare fractures is complete versus incomplete. And sorry about that. Complete is the break extends across the bone, and incomplete, the break is partial. So it might only be across part of the bone. So those are another way that we can look at different breakages. So we have a diagram here that shows the different types of breaks or different pathologies of bone. So this first one is called a pathological break or growth on the bone, and this is usually cancerous. So this will be a form of cancer where the bone tissue is growing at an abnormal rate, and because it's not properly growing and it's growing out of control, this usually becomes an area that is more prone to a fracture and separation of the bone. So this is going to look different in an x-ray, and a lot of times if bones start breaking very easily, they look to see if there's any abnormal growth. This one is called a longitudinal. So you can see that the fracture is coming down almost parallel to the long axis of the bone. And this one is an incomplete. It doesn't go the whole way across. Sometimes this is called a linear fraction. This one is a spiral fracture. So you can actually see that there's a little bit of breakage up here, and this is usually due to a twisting motion. This is, in kids, this is a type of injury that might be if somebody grabs a kid's arm and he twists away from it, or if an arm or a leg were caught in something and there was a twisting motion, this can occur. Also, sometimes this is called an oblique fraction, or fracture, not fraction, fracture. This one is called a green stick. And a green stick is incomplete, but you can see that it is mainly the result of compressing the bone in a certain way and it bends, and then we end up with this occurring. So this could be from a fall or from a squeeze injury, and these are really common in children. Here is a simple. So this is oblique and it just fractures. Unlike the spiral where we have separation up here between the bony parts because of the twisting motion, this one just an impact that breaks the bone, and we do not have a lot of separation. Here is a compound fracture, and this looks like the humerus. So here the bone is actually sticking out of the skin, so there would be a lot of blood loss with this one, and this is a very serious injury. Usually this will happen with car accidents, severe falls, sports injuries. This can happen a lot, especially with the lower leg and the ankle. And there are a lot of very gruesome videos. We'll look at a couple of them. Here is that oblique fracture that we've been talking about. A little bit different than the spiral. They look almost identical, but this one up here kind of just has that extra little breakage that you can see. This one, you can see that we have fragments of the bone. This one is called a comminuted or comminuted fracture. Sorry, can't speak right today. So this one we have bony fragments. So gunshot wounds can make these, or a crush injury. So the bone is actually in little pieces. So they're going to have to operate on this and put a lot of screws and maybe some kind of mesh in here to get the bony pieces all back together. And this one is transverse. So it's not quite complete right across there, but it's perpendicular to the long axis of the bone. We also have a couple other ones, impacted. And impacted is from compression. So a lot of times if it's an impacted injury, we'll have bony fragments, or it's going to be from a direct blow from like a car. So somebody's knees who hit the dashboard might impact the bone and cause a lot of different types of fractures. Hairline or a stress fracture, green stick could be that, but this is basically incomplete with no bone separation. So these are often very, very hard to detect. It might be it looks like a little tiny wee hair on an x-ray, and we end up with a lot of problems from that could occur. But if you're under a lot of stress, you might develop a small crack in your bone, and this does occur a lot. So those are the main types of fractures, and I will have some x-ray pictures and different things up so you can look at these different types of fractures. And when we get back to the classroom, I do have a set of x-ray copies that we can look at. The other thing that might occur is called a luxation. And a luxation is a dislocation. And this is the abnormal separation of bones in a joint. So we'll look at some instances what they have to do to relocate the bone if it is dislocated. So if a bone gets popped out of a joint, they have to put it back into place. It's going to cause severe pain. And usually they will give you a lot of shots or even knock you out with something like ketamine in order to put it back into place.